This is QD Clinic brought to you by RheumNow Live. I'm Dr. Jack Cush from RheumNow.com. Today we're going to talk about weighing decisions in rheumatoid arthritis. We did this today in clinic. We sort of said, what do you do? This or that? Here's some examples. Drug 1 versus drug 2. We don't really need 2 drugs. Which one do we stop? How do you make that decision? Usually, this is in the context of being on multiple DMARDs and trying to stop one. It could be, on the other hand, which analgesic to stop, or it could be prednisone versus nonsteroidals. But let's just say this is 2 DMARDs, conventional DMARDs, biologic DMARDs, it doesn't really matter. The decision is really quite simple. Number 1, ask the patient, which drug do you want to go off of? And this is, of course, assuming that you can go off of therapy and cone down to what is needed, meaning the patient's doing well, in remission, has no swollen joints. But ask the patient, which drug would you like to stay on? Which drug would you like to go off? That drives the boat, at least as far as I'm concerned. The next rung, as far as treatment decisions, might be cost. And that's cost to patient or cost to society. Third might be complexity of therapy. Go with the easier regimen. Patients are already having a hard enough time keeping up with all your prescriptions and all the things that you want them to do. And then lastly, polypharmacy, the drug that's going to take them out of polypharmacy and into some sort of simple regimen. So ask the patient, keep it simple, stupid. KISS. Second issue, do I wean the biologic DMARD or the DMARD, or do I discontinue? What should I do? Well, here it's a different decision. It's actually quite simple. You spend most of your life trying to control rheumatoid arthritis, a deadly, dastardly, progressive, never-ending condition, and yet someone wants to take monotherapy, less therapy. It ain't that simple. So, 1, you should discourage people who want to go off of therapy when they're doing great. Now, that is assuming they've shown you active synovitis and clear-cut evidence of rheumatoid arthritis. The odds of people going to drug-free remission off of therapy are very low, 10%. So do you wean or do you discontinue when they're doing great? Well, ACR guidelines on this were actually quite intelligent, and I think the best out there. They say that if you're in LDAS, low disease activity state, you don't change nothing. The only way you can change is if you're in remission. EULAR guidelines, as we reviewed last week, said that if you're in deep remission, sustained remission, then you can consider changing the interval and taking less drug as opposed to going off of it. And then if you're on 2 drugs, EULAR said you should go off of the biologic or targeted synthetic DMARD first, because if you do go off and they flare, you can recapture response in 80% of patients. However, if you stop the DMARD, which is what I prefer to do, chances of recapture is less. It might be only 50%. But staying on the biologic keeps the patient out of flare, in my opinion, and actually preserves radiographic integrity, meaning they're less likely to progress. Do you increase therapy or add-on therapy? Someone is on methotrexate or a monotherapy DMARD and they're not doing well. Do you swap it out because that drug wasn't working, or do you just add on top of it? The bottom line is that if it was methotrexate, you add on top of it, keep them on methotrexate unless they do not tolerate it. If they do not tolerate it, then you can either go to monotherapy, but really you're going to need 2 drugs, so you need another DMARD like leflunomide, and then you add on top of that either other conventional DMARDs or a targeted synthetic or another MOA, non-TNF or TNF. And then lastly, what do you do like this when the patient's got a lot of complaints, but they got nothing to show for it, meaning they have no synovitis and their sed rate and CRP are normal, and you don't suspect that synovitis and inflammation are out of control, but yet they're not under control. Number 1, analgesics. Most patients tend to underdose their analgesics. Go with safe agents. Number 2, modify lifestyle. And number 3, fix their sleep and identify fibromyalgia and tell them they're doing great. Because when they know they're doing great, maybe they won't worry so much. Speaking of worry so much, if you went to Room Now Live, your life would be great. Let me tell you about our very first session, Pod 1, Rheumatoid Arthritis. Management of Infections in TB by Kevin Winthrop from Oregon. He is the master of disaster. Your disasters being infectious, Kevin's got the answers. Fabulous speaker. Followed up by Roy Fleischman, who is encyclopedic as far as his knowledge of new therapies and drugs that are just now new on the market. He's the guy that does all the trials. He's the first author on all the major drugs. Hear what he has to say. And then John Giles from Columbia in New York is going to give the best lecture you've ever heard on cardiovascular risk assessment and prevention. That's just the first session of many sessions, Room Now Live. Register now, there's still a few seats. We'll talk to you tomorrow on QD Clinic.